Thank you again for joining our webinar, How to Evaluate Your Telehealth Program. This presentation will be recorded, so all attendees will receive a recording of the presentation tomorrow, which you're welcome to view and share with others. This will also be an interactive webinar, so please feel free to enter some questions in the chat and we'll have time for Q&A at the end. I'll begin by introducing our panelists today. We have Angie Connors joining us from Nashville, Tennessee. She's the COO and co-founder of Anytime Pediatrics and has years of practice management experience. We're also very excited to have Dr. George Rogu of RBK Pediatrics and Urgent Care Services join us. RBK Pediatrics is currently a 14-provider group that offers both scheduled and on-demand walk-in visits for patients. Dr. Rogu serves as the CEO and managing partner of the practice and also serves as the president of Independent Pediatric Collaborative of Long Island, a private clinically integrated network. So thank you for joining us today, Dr. Rogu, and thank all of our attendees for joining us today too. I'll hand it off to Angie Connors to get started. Hi, Angie.
Darby, thanks for that intro. Mine wasn't quite as long in experience as Dr. Rogu's, but I'll do my best. So we're excited to have you guys join us today. Really, we're just going to jump right in, and a lot of the information we're going to present to you comes from a couple of different places. One is we are constantly talking to our practices about what they do, what they like, what they don't like. We also worked with an independent group called Health Mavens last year, or actually it was early this year, early 2021, to really do a study of pediatricians and what was important to them in their telehealth solution. So a lot of the information that you're going to see comes from that study through Health Mavens, where we had over 800 pediatricians respond about their telehealth usage. And then lastly, I'll say so a lot of this is also based on studies and information we found out in the market of what other groups have studied about pediatric telehealth. So really, as you're looking to evaluate what's best and what's important for your practice, these are really those top 10 considerations that we're going to talk about today. The first one is reliability and connectivity. Next is product and technical support, pediatric workflows, revenue building. I think everybody talks about that one. HIPAA compliance and security, practice efficiency and analytics, flexibility for all, not only your practice, but your patients, innovation, best practices, and improving access and outcomes. So first, let's talk about reliability and connectivity. So I think I can tell you anecdotally, there is rarely a time when I have talked to a clinician who hasn't said to me, the most important thing about a telehealth visit is getting my patient into the telehealth visit. If you could guarantee they'd be there every time with crystal clear video and audio, my life would be so much easier. And I think it's something that every telehealth platform really strives to do, and that is to make sure that your patient is there, that you can see them and you can hear them. The thing you probably don't think about is, not all that's technology driven. Some of that's user driven, right? Some of that is mom went out to Facebook, snapped a picture, used her camera in Facebook, and now you can't get that in your telehealth platform. So reliability and connectivity, while it sounds like a simple thing, is a little more complicated. So I think one of the most important things about that is kind of pre-testing, right? Let's do everything we can to make sure the clinician, the parent, has access to their camera, their audio, their video, and that we're making sure it's working okay, right? Connectivity suggestions. So depending on the type of device you're on, whether the parent's on, whether they're on their cell phone, they might be using Wi-Fi when their self-service is better, or vice versa. So a lot of that is kind of testing what's best, and does your platform suggest, oh, switch to Wi-Fi and you'll get a better connection. Next is really proactive support. So try as you may to build everything into the platform. Sometimes you're just going to have a hard time. A parent just maybe they're not very technical. Maybe grandma's doing the visit today. Sometimes they're going to need support from somebody who can answer a question. And sometimes that's your practice, and maybe or maybe not your practice has time for that. And then also resource and troubleshooting guides. So, does your platform, does the telehealth platform you're working with have resources that are available to you, available to your parents, available to your staff? Because maybe sometimes they just don't want to get on the phone and they just want to look through it and solve their own problems. So product and technical support. One of the things at Anytime we're really proud of is that we do have amazing product and technical support. So one thing I would say when you're considering your telehealth platform is, you can build all the help you want, as I mentioned a minute ago, but if a parent is not very technical, sometimes they just need a live person to talk to. And that's really not only for your practice, but also for your patients, right? Eileen, who works in our customer support, to me is probably one of the nicest people in the world. But I've heard her go through calls with people who English is a second language, and she will work them through how to get on. Like I said, we've helped grandparents do a telehealth call, but I would encourage you when you're evaluating telehealth to make sure that during the day, there's somebody that you can talk to. Do they respond to you very quickly? Is it just email or is it just a chat? And do they provide you some ongoing support, right? There's always ways to think about your platform, and can you use it differently, or have you thought about different ways to do it? It's one of the reasons I love that Dr. Rogu is on our call today, because I think he's a leader in how can you do things differently, and he's going to talk a little bit about that in a minute. So, do you have access to best practices for telehealth through your product? Next slide, Darby. So pediatric workflows, number 3. I think that workflows, obviously, as a practice manager, are super important, right? They're kind of your bread and butter of how is the day going to go in your office. And when I think about telehealth workflows, they should complement what you do in your practice, right? It should be something that doesn't stress your staff, stress your clinicians. It should be something that can flow the same way that you want it to flow. So for a lot of practices, they'd like that telehealth to mimic what's the in-person, right? A patient comes in for a telehealth visit, they can have a virtual check-in. Why is that virtual check-in important? Well, I could confirm their insurance. I could triage that patient. I could check their audio and video. I could do a virtual check-in. And really then I could route them on to the provider who would have that telehealth visit. And if they needed a follow-up, they could route them back to the front desk to schedule that one. So for me, as a practice manager, knowing that the workflow, regardless of whether that patient is virtual in the office or in the office, is the same, that's going to make my day a lot simpler, and it's going to make my staff's day a lot easier. But if I look at number 3, customized workflows are one of the most requested functionality, because like I said, that process I described maybe works great for one practice, but another practice really just wants the virtual visit to come in and go right to the doctor that that's scheduled for, right? So they don't want to use a virtual front desk. So having that flexibility, not only to use different workflows, but to change the workflows based on your resources, right? Maybe it's a Friday, maybe you have less staff on Friday, and today we don't want to use the virtual front desk. So when I think about workflows, I think about making sure that they work for my practice and that they have flexibility to meet the needs of my ever-changing staff. Maybe today somebody's out sick, they're the person that normally manages the virtual front desk. So instead, I'm going to have it go right to the clinician, or maybe I'll have it go to someone else. So make sure that your workflows in your telehealth work for your practice. But I would also challenge you in a pediatric practice to think about it differently. One of the things we hear a lot is, well, this is how we've always done it. And sometimes just because you've always done it that way doesn't mean it's the way you should be doing it now. Thinking about things a little outside of the box maybe will help you use telehealth in a different way. So revenue building, right? Telehealth platforms should help grow your practice. It shouldn't be something that makes your practice less efficient. And it really is one of the top 3 reasons that people choose a virtual care partner, right? Does your telehealth platform help you use best practices? Does it help you drive revenue? We're going to talk a little bit specifically about driving revenue, but virtual care can be so complementary to what you're already doing. It can help you manage staffing. It can say, gosh, this provider is home with a sick child. They could still do virtual visits all day long if their kid's not feeling too bad. But there's just so many things you can do to drive revenue above and beyond that standard traditional way of seeing your patients. So let's talk a little bit about how you can grow adoption. So one of the things that a lot of practices do is move those second visits for ADHD or the follow-ups to telemedicine. one of our very first providers on our platform used to schedule her Wednesday afternoons to work from home and book those ADHD follow-ups every 10 to 15 minutes. She could work from home in Atlanta. She could avoid traffic one day a week. And she said it was so efficient that she could see more patients in that standard time slot. The other thing that we don't often talk about, but we know that's out there, is that leakage to competitors. Your patients are seeking convenience. So if you can capture some of those patients who maybe don't want to drive into the office but need a visit, it's a great way to add additional visits per day for each clinician. So another revenue outcome is adding after hours. So Anytime Pediatrics has recently added an after hours component to our offering, which is really a nurse triage component. So that's the ability to use our nurse triage service to triage your patients. So when your practice is closed, practices are doing this a lot of different ways. Some are using an answering service. There are some practices that don't take call and they tell people to go to the urgent care or the emergency room. Some are having those calls go directly to the doctor. There's a lot of different ways to do that, but as hard as clinicians are working right now, Anytime After Hours is a great way to have a nurse triage service, provide advice to those parents, see who needs to be seen immediately. Can that be seen via telehealth that evening? Or should that be scheduled for the next day? So a great way to reduce that leakage to, gosh, it's 6 o'clock and my child has a rash. I don't really want to miss work tomorrow. I'm going to do something right now. I could go to Anytime After Hours. That could be triaged, and then that could be converted to a telehealth visit. So for the clinicians on the call, before you throw your hands up and think, well, that sounds like more work than I'm doing now. One of the nice things about Anytime After Hours is those evening telehealth visits could be scheduled at a certain time. So maybe your kids are tucked into bed at 9 o'clock and you want to do telehealth from 9 to 9:30 each night. So our triage nurses would schedule that telehealth visit and you wouldn't need to be on call all night for those telehealth visits. So we have a great ROI calculator we can share with you. You can put in your numbers, how many clinicians, what you get reimbursed, and really look at how you could grow revenue by adding nurse triage to your practice. So HIPAA compliance and security. So when the pandemic started, this was obviously not a concern, right? When COVID started, the government said, hey, any way you can do telehealth, that'll work great for us. But that's not going to be around forever. So you really do need to use a HIPAA compliant platform. I mean, in the medical field, we've all talked HIPAA compliance for, seems like till we're blue in the face, but that is such an important component for telehealth. It really does protect, you as a clinician or your practice from any type of data issues or security breaches. And make sure that when you're looking at a telehealth provider, that they really do have those protocols. They can talk to you about them. You can ask them about their security, because that is really important. So practice efficiency and analytics. So, some people are numbers nerds, some people aren't. But if you look at the data analytics of your telehealth platform, it's really going to help you understand what telehealth is doing for you and whether you can do it better. So some of the things you can look at is, visit types. What am I using telehealth for? So am I using it only for ADHD, or am I using it only for sick visits? Am I using it only for COVID screening? Or am I doing a variety, and has that changed month to month? Looking at documentation, right? There's a lot of information in your telehealth platform that can help you do documentation. And that's key for your reimbursement. Because if you've ever dealt with healthcare insurance reimbursement, you know that 60, 30, 90 days, they come back to you and say, do you have this? Do you have consent? Do you know how long that visit lasted? All that in your documentation really helps you. Patient satisfaction. Do your patients love it? We are all marketing all the time to our patients, and knowing how satisfied they are helps you. And why are they there? So it's also key to benchmark among practices. So we currently don't do that in our platform, but it's something we do within our practices, and it's something we're growing in our reporting. And lastly, that data analytics really supports you if you're working towards the patient-centered medical home. And as we all know, that really helps drive your reimbursement as a practice. So the higher you are in the patient-centered medical home, the higher certification, the the better your reimbursement is going to be. So let's dive in a little bit into data analytics and how that can help drive your practice. So let's talk about patient satisfaction. My guess is every clinician and every practice on this call is marketing to their patients. You've got a website, you're posting on social media, you know that your parents are on social media, they know people are searching their website. So being able to take that patient satisfaction, which is already in the platform, which your parents respond to at the end of the visits, and promote your practice is a great thing. You know, parents will be happy to give you a quote. A lot of times they write comments. That is just a great way to drive satisfaction and to drive your reputation. Visit types, right? So one visit type that some of our practices use that's really effective for them is an on-demand. What is an on-demand? It's a virtual walk-in, right? So, you know, a lot of practices have walk-in hours. Would it be helpful for you to offer that? You know, do you get a lot of phone calls in the morning between 8 and 9 when instead of having parents call, they could just request that telehealth visit? You can look at the information in your data analytics and see if it would be helpful for you to offer that. You can also look at what type of visits are you doing? Am I doing all scheduled appointments? Am I doing a lot of instant invites? You know, an instant invite is a great way when a parent calls in on the phone to convert that into a telehealth visit. Hi, Mrs. Connors, I'm just going to send you an invitation for a telehealth visit and you can see Dr. Smith. And last, your visit reason. One of the data analytics of looking why people are coming is, you know, what are they coming for? What are the types of things that I'm treating? So looking at that can help you decide when to offer telehealth, how to offer it. Is it one day a week? Is it certain hours of the week? How should I do that? So the dashboard for analytics and driving patient needs, these are some of the things that you can also look at. How long are patients waiting to be seen? So looking at, okay, a parent has just requested a virtual walk-in, but they're waiting 25 minutes. You know, how is that how is that affecting my parents and their experience? Looking at, should I offer after hours or weekend care? And also looking at which type of chief complaints have been most successful. You know, there's certain visits we always think of as a telehealth visit, but there's also, especially talking to your peers, and that's one of the exciting things Dr. Rogu is about to talk about, is what are other ways to use telehealth, right? You know, we all think about the ADHD, but what are some of the other things I can do? So why is this information useful for your staff? One is the more you look at your data and the more you analyze it, the more you'll be able to help your staff use telehealth effectively, right? So let's look at what we're doing. Are we duplicating our efforts? Are we scheduling patients when maybe we should be using an instant invite? Looking at what your workflows are, looking at the data for telehealth will help you make your staff more efficient. So some of the things that people said are the most important or the most helpful parts are having those photos as part of the visit, having the documentation and knowing how long a visit lasts. And know that all the information that's within the system, in the telehealth system, can help give you data for your patient-centered medical home certification, right? We are available for our patients in the evening, which keeps them out of the ER. We're open for walk-ins in the evening from 5 until 10. Different things like that will help you with the patient-centered medical home. Flexibility, right? So let's talk about how to use your telehealth platform. So most clinicians do use their computer, probably because they're, you know, using that at home or at work, just like they would see a patient in the office, but they can also use it on the go with their phone or a tablet. We do know that over 60% of families use mobile devices for their telehealth visits, but know that they can access it any way they want. They can be on a smartphone with an app. They can be on a smartphone with a web browser. I think one of the things to know is, as we started our discussion today, is we talked about how important it is to get a patient in a visit. By having all these different ways to access that telehealth visit, you can always say, oh gosh, you don't want to download an app. You can use a mobile web browser. There's just so many different ways to do that. And really, you know, having options for different workflows will really help you use telehealth different ways, right? Routing through the front desk, allowing that patient to be checked in and sent to the right provider. inviting a nutritionist into a visit if you're having a visit that would, or a lactation specialist, or a mom is in one spot and dad is in the other. Just providing flexibility for everyone who's using telehealth, whether it's the parent, the staff, or the clinician, really is an important component of evaluating your telehealth platform. So what are some of the common questions we get when we talk about flexibility is, why do you have apps, right? Because, oh, my parents download all these apps, they don't want to download an app. Well, research does show that 80% of parents prefer an app, but for the ones who don't, they can use a mobile web browser. Why do you want them to use an app? Well, they're going to create a registration, and that's going to add value to your practice. Clinicians love the app because they can be on the go, but no, as I just mentioned, you don't have to download an app if you don't want to. So I want to talk just for 1 minute about why patient registration is important, because we talk about this a lot. And people are like, well, if I just give them a link and they pop into the visit, they're there. Well, if they just have a link and pop into the visit and you have no idea who came, then you're not going to have any way to do documentation, right? You're not going to have guarantee of consent. You're not going to have the duration of the visit. You probably, if they just jumped in with a link, you may or may not have a photo. But once parents have registered, they can also manage some of their telehealth needs, right? They can see that they have scheduled appointments. They can use the information in their visit summary to do a school note. So having that patient registration makes your staff's life easier, but it also hopefully decreases the number of calls that come into your practice. So innovation, that was number 8 in our survey as to what is important in a telehealth program, right? So think about, I'm sure everybody in this call can think about telehealth 3 years ago. No one was doing it, or very few people, or pioneers like Dr. Rogu. But really, innovation is constantly finding something new that helps it deliver better care for the pediatricians. So by incorporating a flashlight, so many stories of a clinician saying on a telehealth visit, can you turn on the flashlight and I can look down that child's throat? Having the ability to share your screen as a clinician. Maybe you've got some information that you've got that's education and you want to share that, or even send it as a file afterwards. Including a live translator. Sometimes mom and dad don't speak English as their first language, and having a translator helping make that visit be more effective. Integrating outside devices such as otoscopes, or integrating to EMRs. So a lot of these innovations are what we strive and all you should be looking for within your telehealth platform. So one of the innovations at Anytime we are probably most proud of, and we were really built upon, is our patient routing. And that's where we were built to say, telehealth should connect you to the right provider at the right time. And so what we do at Anytime is we allow visits to be routed from the front desk to different clinicians within that practice. So maybe mom is here for a scheduled visit with a clinician, but she really needs to see a lactation consultant. So that front desk could route that patient to a lactation consultant. So really what that does is it builds that relationship between the patient and the practice, because they know when they connect via telehealth, they're going to see the right person. And your practice can control through the routing who they see. It also helps you to make sure you're using the right person, right? So maybe a patient needs to come in and they need to see a triage nurse via telehealth. And once the triage nurse has had time to talk to mom, see the baby, they realize that mom's happy, you answered her question about that diaper rash, and they don't really need to see the clinician. It also will allow you through routing to move that patient to the right provider. So maybe Dr. Rogu is out sick today, but he had scheduled appointments. We can still route those visits to another provider in the practice. So as I said, really connecting your patients with the right provider at the right time is what that intelligent routing is built upon. Innovation. So, innovation is something we think about all the time, but there is just so much here that we talk about all the time and we continue to strive. But I would challenge you, as you're looking at a telehealth platform, to know that your telehealth provider is looking about these things, right? So are they thinking about different family types? What if a 14-year-old needs a visit, right? What if, and they want to have that visit individually? does my telehealth platform help me with screenings? Are these, whether they're vision, hearing, ADHD? How do we look at prevention? What can we do through telehealth for prevention and really providing access, not only after hours, but to the underserved and including specialists? So what's the best practices? So on this, really, I think that you should look at a telehealth solution and know that they can meet you wherever you are, right? We always say at Anytime, if you know one clinician and how they work, you know one clinician and how they work. Everybody works differently. And at Anytime, we do have multiple solutions to meet the needs of different practices. So when we look at Anytime Go, it's really, it's self-guided. It's really for that right direct clinician to patient. You still have an administrator account within there so they can support that clinician. But once a practice is done with Go, or it feels like they're ready for more, they can evolve to that premier level, which allows that virtual front desk and the virtual walk-in. But just know that at Anytime, we're here to support you wherever you are within your virtual care. And, one's not better than the other. There's different needs for different practices, and we're here to help support you. So I'm going to turn it over to Dr. Rogu. He, as I mentioned, is an innovator. We have loved working with him and his practice at RBK. But, as long as I've known him, I thought I knew everything he did. But when we met to talk about this, I think he's really got some great strategies and innovative ways that they use telehealth. So I'm going to turn it over to you, Dr. Rogu. Next slide, Darby.
Okay, hi, I'm Dr. Rogu. I'm always trying to find different ways of doing things and eliminating stress to the physician. So I have all the doctors sitting in one office. We share the office space, and I would hear physicians get on the phone, talk to patients about their laboratory results. I mean, it was ending up being a 15, 20-minute conversation. Back in the day, we said, why don't you just bring that patient in to talk to them? Or I would find another physician getting angry that, I called this mother, I left her 3 voicemails, she's not answering, she's calling me back now when I'm really, really busy. One day we just decided all laboratory tests will become telemedicine. What that did was it gave a dedicated spot inside the schedule for the physician to actually sit down, not chase the patient, review the laboratory results, and answer any questions that the patients have. It was very simple. And you know what? People loved it. Initially, the doctors were a little apprehensive. They're saying, oh, it's just another patient, another slot. I said, but you're going to be doing it anyway, and you're going to be doing it for free. So now with telemedicine payments, you're actually doing something that generates some income. And it's actually good medicine because, in today's, the kids of today, who doesn't have a low vitamin D? Who doesn't have elevated cholesterol? Who doesn't have something that you need to tell them to do something? So we got rid of that 20-minute conversation. It's telemedicine. Another idea that we had is, we do a couple of the physicians in our office perform ADHD evaluations. So that's a little bit of a drawn out visit. But in between their evaluations, they're doing these neurological tests. It's called the TOVA test. The patient physically has to make it to the building to do the test. So in the past, we would schedule it with the physician. He would set it up with the nurse. They would go over, the patient would run the test. We print out the results, and then the physician would go in and speak to the patient about the results and answer any questions, make a diagnosis, and so forth. Now everybody's really busy with appointments. So, the luxury appointments, those are the ones that go to the wayside when there's no appointments available. So what we decided to do was we set up a ADHD TOVA testing room where the patient comes in, the nurse sets it up, prepares everything, runs the test with the patient, everything's done. They print out the report, they scan it into the child's chart. And then the physician, when he has time in his schedule that day, now goes over that report with through the telemedicine platform. Once again, dedicated time. The physician is happy because he doesn't have to stress. The patients are happy because they have the attention of the physician who's not, just waiting to get out the door. Next slide. We're using it for immediate sick visits, on-demand visits, which, everybody looks at telemedicine and says that's where telemedicine is, the sick, quick and dirty visits, conjunctivitis, pink eye, whatever, constipation. that's good. But a lot of physicians have their brick and mortar office, so they're going to be seeing them in the office. But sometimes, they're late or something happens. Instead of waiting for them, you could just beam in with the telemedicine and just resolve your problem, and everybody's happy once again. Sometimes you have the nervous mother that, is 3 days old, the baby's crying, or, has gas problems or something. You can evaluate a child through the telemedicine platform and get an idea of, is the child really sick or is just a nervous mother? And the luxury of having telemedicine and an office, if there's a problem, you bring them on down to the office. Simple as that. I've used it for mild medical problems. We've used it for, how many times do patients go to like one of these urgent care centers, city MDs or something, where they see nobody, somebody does a test and it comes back, they get a text message that they have a positive test. And then they say, call your doctor. You're going to call the doctor. There's a million questions that they ask where us as a physicians, we don't feel that it's that big of a deal. To a patient that has a positive COVID test, yeah, it's a big deal. Their grandmother passed away of COVID. So you have to do a lot of reassurance and explain to them what did they have to do, how long did they have to quarantine. Old days, you would have done this on the phone for free. Now you just make a telemedicine visit out of it. And a recent thing that one of my physicians has been doing was the pediatric weight management program. One of my physicians, he's a specialist in weight management with children. And, these are visits that are a little bit longer, and sometimes people forget about them. So you block out some time, the patient doesn't show, the doctor is now sitting doing nothing. So what we do is sometimes when that happens, we call them up, hey, you missed your appointment with Dr. Riley. Let's beam in through the telemedicine and go over the stuff, because it's mostly counseling anyway and reviewing of labs. So that's another way that we've used the telemedicine platforms, for catch up, people that no show, because it'll go to the leakage. If they don't show, they'll go to an urgent care, they'll go to an emergency room or something. So you might as well at least get a one last ditch effort. And, we also use it for ADHD medication renewals. I have to say it's embarrassingly fast through the telemedicine. I don't know why. The same visit takes longer in person. What are you going to do a little different if the patient comes in with the child? You'll do a quick exam, but it's just so much faster on the telemedicine. I don't know if it's that they're lined up one after the other and I'm sitting there going through the process, but it just takes, the parents love it because they don't have to make an appointment, drive, park in the parking lot, get out of the car, go check in curbside, online, go to the room. Maybe I'm there quickly, maybe I'm not. So, the med renewals works well. Next slide. So I think we just have to, as the slide says, think outside the box. It's not just sick visits. So
Dr. Rogu, I'd love to jump in and ask you a question that you and I talked about is, you guys think outside the box, but how do you get the buy-in from your providers, right? Let's be honest, you guys like to do things the same way. How do you move them to new things?
That's tricky sometimes. Fortunately, we don't have a lot of senior physicians that are set in their ways.
Yeah.
Fortunately, I've become one of those senior physicians.
Not you.
But a lot of the docs are tech savvy. They want to leave, we have a thing in our office. We have to leave on time. So do what you got to do throughout the day, make your life easier, be happy, and leave at 6 o'clock. If you're staying until 7, 8 o'clock, there's something terribly wrong. Mm-hmm. So, they've realized that, whatever we do, we're trying to make their life a little bit better. So they usually catch on. They'll squeal a little bit at the beginning, but then, if somebody does it, then they watch it and then they get curious and then they say, can I do it too?
Yeah.
It works out pretty good. You just don't mandate it. Doctors don't like to be mandated anything.
Right. That's very true.
Yeah. So.
All right. So I guess it's back to me. Thank you, Dr. Rogu.
No problem.
I think we just have a couple more slides before we're going to open up to questions. And I think this last one, 10, is one that's near and dear to my heart. And that's really improving access and outcomes, right? improving the access for all families to quality care. So how do you do that, right? One thing to know is, providing a translator depending on your patient population is really important, right? Can you bring them into that telehealth visit? Can it be, can you provide, language needs are different based on where you live. So not everybody needs a Spanish interpreter. Some places need Portuguese. So knowing that you can have additional interpreters based on what your patient population is. So how do you improve access? In addition, we do have our application available in Spanish. So that means the parents who are Spanish speaking can do the app entirely in Spanish. Offering, we work with a foster care program to help do care coordination for their for the children in foster care. And also, I think one great way to improve access is that after hours. Parents want and need to talk to somebody sometimes after hours, nervous parents or kid came home from after school activities. But one way to improve access is to be available, right? To have your practice and not necessarily you, the clinician, whether that's a triage nurse or someone else, or whether you're available through telehealth to have something in the after hours. So driving access for the underserved. So this is something that, we've talked a lot about at Anytime, and connectivity testing is one of the things that we do. I mentioned Eileen Foley, who's in our support. She told the story of a mom who had a crying baby while she was on support. She could not get her phone to work, so she got her husband's. Her husband, they didn't have any cell service or Wi-Fi. She stayed on the phone while they drove to, I can't remember what store where they knew they could get Wi-Fi in order to have that telehealth visit. It was quite a long process, but it just kind of shows that we assume every parent or patient, depending on where we live, has that ability to connect to telehealth. And so having connectivity is important because it really does say, hey, I'm going to be able to have this visit, or maybe I won't, and I need to go somewhere I can. I just told the story of why that live support is so important. Parents are panicked sometimes when they make these telehealth calls, and sometimes them struggling with the technology is as much their anxiety over their child as it is the technology. We do work with partnerships to other underserved areas. And I would say if you are in an area where you're looking to do a partnership, you have someone you're working with, we would love to work with you, whether that's on a grant. There's a lot of rural health grants out there right now for technology and telehealth, or whether that's to help connect you with people who provide low-cost data plans. We feel like telehealth should be a connector for all. So we would love to partner with you in your practice if that's something you're trying to do. So this quote is really from a webinar we did I guess it was back in the spring, but I thought it was just a great something to talk as we're talking about access to look at. And it really came from a study on parents who, bring their child to the pediatric primary care, but are not proficient in English. And it really talks a lot about what those values, the value of that telehealth visit, right? To provide same-day sick care, whether that's through telehealth, to expand your hours, to have that language services. These were the things that these parents, these mothers felt was most important to improve the quality of pediatric care for their children. Next slide, Darby. So one other way we've mentioned a few times that why I just wanted to kind of talk a little bit about Anytime After Hours is that based on surveys, 80% of that after hours is really hand-holding, right? It's comforting a parent, telling them their child is okay. So by having a triage nurse available to comfort those parents, to give them the information they need to determine, as Dr. Connors always said, sick, not sick, right? Is this patient truly sick in the after hours? Do they need to be seen immediately or tomorrow? But really through Anytime After Hours, we've added that video component, which makes a triage nurse so much more successful. I love the triage nurses we work with because they say when you do triage via the phone, you are working blindfolded with your hands tied behind your back, right? So when you add a video component to nurse triage, you've really given that ability to see, does that child look dehydrated? They're running around and they're playing with their sibling. Maybe they're not as dehydrated as the parent thinks they are. With Anytime After Hours, as I've mentioned, you could route to that physician on call. So I know it's appropriate for telemedicine. That child needs to be seen. I could route that. I can have notes for that Anytime After Hours. There's also a call recording and audit. So if with Anytime After Hours, you'll always know how those visits are handled. We can also, through Anytime After Hours, have access to your EMR if you choose. That's for not only looking at, hey, were they in already today, or can we schedule an appointment for them tomorrow? And access is about keeping your patients connected. So let's reduce that leakage to the urgent care and keep them connected to the medical home. So finally, this is one of my favorite quotes from that study is that 90% of clinicians believe their patients find telemedicine easy to use and will come to expect it as part of their family's care. If you look at any study that's been done about telehealth, consumers want it. And after the pandemic, they're going to expect it. Why could you do an ADHD follow-up via telehealth 6 months ago, but now you want me to come in the office? So choose that telemedicine solution that's going to be here for your practice today and have the innovations you're going to need tomorrow. So one quick thing, we talked about revenue, but a little bit on the finance side. There are some deductions you can get off your taxes for the cost of your telehealth software. I hate to give any type of financial advice. I never really tell people how to bill and code, even though I've done billing and coding, and I'm not going to tell you how to do your tax break. So I would encourage you to talk to your financial advisor, but there is a section 179 that will give you a tax savings for your telehealth platform. So Darby, we're going to turn it back over to you for questions.
All right. Everyone is welcome to enter some questions in the chat or in that Q&A section, and we'll be happy to help answer.
So I'll ask Dr. Rogu a question while we're waiting.
Sure.
Do you feel like your telehealth is pretty consistent year round, or is it more of a winter sick thing, or is it pretty stable through the year?
Well, the whole year was an unusual year.
Yeah, it's hard to compare. There's no baseline, is there?
We back last year in the summertime when nobody wanted to come in for their checkups, we did the virtual well care where we had the people in the parking lot do their the well care through the telemedicine. We ordered the vaccine, did anticipatory guidance and everything else, and then we welcomed them to a tent that we had in the grass in the front of the office where we examined the kid and the nurses gave the shots.
Yeah.
We didn't do that this year.
Right.
But last year was a big hit.
Yeah.
We were doing the antibody testing last year. This year it's not so popular.
Yeah.
So it's hard to gauge. But
and I guess flexibility is the key, right? I think that's the thing is, it is a great comment there. With telehealth, there really is no baseline, right?
We had another question come in asking, will the ROI Excel sheet be available to participants?
Absolutely. We'll send that out when we send the recording. I think usually it goes out tomorrow, Darby.
That's correct. It'll come out. Everyone will receive a follow-up email in 24 hours.
Yep. So we will make sure everybody gets that. So I don't think we have a whole lot of questions, but I can tell you if you, walk away from this and have questions, you can always reach back out to Darby or however which email you received from the invitation to this for. We would love to, answer any questions that come up. We can also ask Dr. Rogu any questions you might have for him. He is a great innovator. I learn something new from him every time we talk.
Angie, I think there's two people that raised their hands and they're on the phone.
Yeah, I see some hand raisers here, so I'm going to give them the permission to talk. So I see Julie Loomis.
Hello. I just had a question about how you handle ADHD patients who are across state lines. Maybe they've gone home for college, or they're just they live in a bordering state, and if you're not licensed there, do you still have to bring them in? What have you been doing to manage that potential issue?
Well, they usually come home every couple of months. So we do touch, we do an examination every couple of months on them. And, some parents, they prefer to control the medicine. So they want the prescription sent to their local pharmacy and the mother will mail it to them. I've had a couple of cases where the kid was at college and you could, send a prescription to that particular place too, near the school.
Yeah, I guess we're about to face, like in our state, Tennessee, we're going to go to all electronic prescriptions being, or all controlled substances, regardless of their schedule, being electronically prescribed. So it kind of, as far as I can tell, is going to eliminate that serial prescription option where you can give them, dated a month later, issued today, but do not fill for another month, where you, and some we've already had some pharmacists refuse to fill scripts, which I know becomes a whole other issue. I was just curious if others were having that problem.
And New York is electronic, so I haven't seen a paper script in about 4 or 5 years.
Right.
So Julie, I will tell you that this discussion has come up with other clinicians we work with about the kids away from college who are ADHD or who are at college in a different state. And that sometimes, one of the practices we worked with in Illinois took that to their medical malpractice carrier, who they said, since the patient is from the medical home, even though they are located in a different state, they still felt like they could provide that telehealth to that patient because they're connecting to the medical home. So even though the patient might be in Alabama for college, they're licensed in Illinois. The patient comes home, as Dr. Rogu mentioned, annually for that physical checkup. So when they do those check-ins, their malpractice was fine with them doing that across state lines.
Okay, well, that's a good angle for sure to consider. Thank you both very much. Excellent information. And I love how you're pacing and you really got everything in. I appreciate it.
Thank you.
You all are welcome also to respond to the follow-up email you'll receive with the ROI calculator and the recording, and feel free to reach out to me with any questions as well.